I have to talk about uterine factor of infertility. All of you know that the uterine factor of infertility is a real problem for many women. And my objectives are to identify recent treatment modalities of cases of absolute or hopeless uterine infertility. I'll talk on the incidence, on the causes, correctable and uncorrectable causes, treatment options of uncorrectable causes, future, and take-home messages. All of you know that the uterine factor accounts for 20% of female infertility, but unfortunately it is the least investigated part of the female genital tract. And if you look at the ASRM recent release on 2012 on definition of unexplained infertility, you will find that they mention that the unexplained infertility means that the fertile husband or normal semen analysis of ovulatory woman and normal tubal patency tests. What about the uterus? They did not mention anything about the uterus. The same goes in all recommendations of all societies. They are not talking too much about the uterus. And most of the gynecologists rely on the transvaginal sonography and hysterangiography, but transvaginal sonography can miss fine adhesions or fine polypi, and also hysterangiography, the dye may mask delicate lesions. In a recent publication published by our team last year, we found that office hysteroscopy could diagnose intrauterine lesions in patients with normal hysterangiography in more than 23% of cases. We may find some correctable causes of the uterine factor of infertility like fine adhesions, moderate adhesions, septum, polypi, or submucous myomata. But unfortunately, you may be confronted with some more risky or more difficult cases like severe uterine hypoplasia with lost uterine cavity, or patient who was obliged to do hysterectomy due to postpartum hemorrhage to save her life, or for multiple myomata, or cases with extensive intrauterine synechia. Such cases may occur after some vaginal surgery or gynecologic surgery, some post-operative or postpartum cases, or severe endometritis. In such cases, if you go with the hysteroscope, you will find the uterine cavity has been changed into tubular cavity, small, narrow, collapsed. You may not find any landmarks to do lysis bluntly or with the energy modalities, and these cases are difficult cases, and the resumption of menstruation and fertility is difficult. Some studies on using some intrauterine gel, placement of intrauterine balloon, intrauterine device, amnion grafts, and others. All these trials are done to improve the prognosis for fertility and menstruation. But in many cases, you are sorry to tell your patients that I don't have any solution for you. The same goes to patients with uterine aplasia like Rokitansky-Kastner-Hauser-Meyer syndrome, where you are seeing no uterus and the ovaries and tubes are seen in the flanks. This is a typical case of Meyer-Rokitansky. So you are obliged to tell your patients that you are a hopeless case for fertility. But this is wrong. You should not have to tell your patients that you are a hopeless case. You should have to tell her that there is a hope for you going on the road. Some solutions and some hope is coming. This solution started in the last century, before more than 150 years. But the recent attention with some animal studies in the United States on auto-transplantation of the uterus and subsequently delivering a pregnancy from this uterus in the same dog. And in 2010, some studies on the first successful allogenic transplantation in rats was successful. We have to know these are pictures of these animal studies. We have to know some words on the types of transplantation to be aware about this topic. We have autologous transplantation and allogenic or heterologous transplantation. Autologous means that you are transferring the organ from the same individual to another part of him. And the famous example is skin and plastic surgery transplantation. They are taking a part of the skin from any part of the body to cover a raw area. And the second is allogenic, which is heterologous. You mean that you are transferring an organ from one individual of the same species to another individual. This is associated with rejection in all cases, except if you have a patient who are monozygotic twins, you will not be confronted with rejection. Another rare example, which is xenogenic, you may transfer organ from one species to another one. For human studies on uterine transplantation, we have to mention Dr. Wafa Faqih, who is the first doctor all over in the world to start uterine transplantation in 2000 in the Kaiser Saudi Arabian King, in fact, Hoster. She transplanted a uterus from mother to her daughter after a hysterectomy of the daughter. And the uterus was sustained for 99 days, but unfortunately, it needed a hysterectomy due to blood clotting. The trial of Wafa Faqih was subjected to some concerns like no prior permission of the health authorities, no prior basic science research, no animal studies, questionable health problem of the donor, no prior Islamic Council approval, and some technical problems was done by Dr. Wafa and her team, like non-leaving of a long pedicle for the transplanted uterus, no endopelvic fascial support. And some studies mentioned that the cause of rejection of this uterus was inversion of the uterus due to a lack of support of the uterus. We have to know that the uterine artery is a tortuous artery, long artery. Don't miss this point. The second trial was done in Turkey by Dr. Omar Imran and his colleague on a patient in 2013, and the uterus was successfully implanted, and they tried IVF for this uterus, but unfortunately he published a strange paper entitled "The First Womb Transplant Baby Set for Arrival in January 2014," and this was after pregnancy test has been done for this patient. And he did not mention inshallah, like Turkish people always mention inshallah. He did not mention inshallah, so this uterus, this pregnancy failed and ended in missed abortion at 8 weeks. But still we have a hope after a research grant got from the Gothenburg University, in the Swedish Gothenburg University, by a team, a famous team, Mats Prunestrom and his team. They got a grant to start on 10 cases for uterine transplantation and in 2012, and then another grant to make IVF for the successful cases. They mentioned that they will start by 10 cases, and 8 of them were successful, 2 failed due to uterine artery clotting, and 1 for severe uterine infection, and then started the second phase of IVF. But when they published their paper in the fertility society, they reduced the number to 9 cases, and the operative duration for donor extraction of the uterus was 10 to 13 hours, which is a very long time, and operative time for the recipient was 4 to 6 hours. And after 6 months follow-up, only 7 uteri were viable with successful menstruation, and 4 were subjected to mild rejection, 2 cases graft loss. One of the successes for the Mats team is they used a long pedicle, and all this trial was preceded by a very long period of animal and in vitro studies. And this is the shape of the uterus after implantation, and this is the successful pregnancy, normal Doppler of the baby and the uterine artery, umbilical artery, and this baby was delivered due to severe preeclampsia at 36 weeks. And long pedicles was the key of success and previous research. However, some concerns of their technique, including the use of immunosuppressant drug-related side effects like cancer development for the patient, radical hysterectomy may have a bad impact on the psychological status of the donor. Potential offsprings are at risk because of possible insufficient blood flow, organ transplantation complications like infection and rejection. So uterine transplantation from a donor to a recipient is a good hope, but it is not the ideal because it has some concerns, lengthy operation, prolonged with tedious work, with cost. So the goal of the research nowadays is towards the bioengineering of human uterus, and this is an animal study published by Mats Brunstrom and his team also on the trial of bioengineering uterus. So in conclusion, Mr. Chairman, ladies and gentlemen, I'd like to say that most of the absolute uncorrectable uterine causes of infertility are preventable. We can prevent absolute causes by prevention of intrauterine synechia, prevention of unneeded intrauterine operations, prevention of uterine infection, and so on. And meticulous microsurgical procedures for myomectomy will prevent this absolute type of infertility. But in some cases with congenital abnormalities or the patients are obliged to remove the uterus, we have a hope, which is female genital organ transplantation, which is an old idea, gained fresh attention. But to have a successful trial of uterine transplantation here in Egypt or elsewhere in the world, you have to have a good team. The team like this published Infertility Sterility team from the Department of Obstetrics and Gynecology, Department of Transplantation, Clinical Pathology, Genetics, so and so and so. So collaboration and team approach is the key of success, and the future is promising with tissue-engineered uterine transplantation. Thank you very much.